7 Principles of Highly Profitable Dentists by Christina Blatchford, DMD, and William A. Blatchford, DDS. Begin in gratitude. Think big. We are grateful to those who have gone before us as we stand on their shoulders to reach for the stars. My grandparents were dairy and filbert nut farmers. Despite their rural and demanding occupations, 3 managed to graduate from college, and all were pleased that their children, my parents, pursued graduate degrees and beyond. Both my sister and I have been encouraged to dream big. Just imagine the roles our children are dreaming. My little Gracie wants to be an astronaut dentist. The purpose of this book is to inspire you in the same way our grandparents and parents inspired us to pursue a better life. You made an excellent choice in becoming a dentist. Let us take you on a journey now to make that excellent choice even better. Let us show you how to be more profitable with increased net, have more time away to refresh and be ready to work again, and enjoy a renewed passion for dentistry. Your children need to see you enjoying your work and profiting from it. If your income isn't what you planned, or you have little time for family or self, you're sending a message that says, choose something else, because dentistry isn't it. By working with Blatchford Solutions, you can create a life-work balance where income and free time are increased and stresses from work are reduced. Isn't that what you want your children to remember when it's their turn to make life choices? Give them the example of a happy, profitable practice so they can stand on your shoulders to make their lives better. We'll show you how. Dr. Bill Blatchford is one of the strongest voices in dentistry today for profitability with special emphasis on mastering sales conversations. He is a dentist's advocate for more net return, more time away, and increased enjoyment of life. Dr. Blatchford is very proud to work with his daughter, Dr. Christina Blatchford, who has purchased Blatchford Solutions and is very encouraging for her father to continue speaking and advocating for dentists. They are a father-daughter team. Dr. Blatchford practiced dentistry for 20 years in Corvallis, Oregon, following graduation from Loyola Dental School. For 35 years, he has helped thousands of doctors to achieve practice success and stay in the game. In their custom coaching program, Drs. Blatchford work personally with doctor, spouse, and team to achieve their dream practice. Dr. Blatchford is author of Dentist's Mighty Guidebook, Playing Your A-Game, Blatchford Blueprints, and with Christina, they have written No Nonsense Transitions, Bringing Your A-Game 2.0, and the latest book, 7 Principles of Highly Profitable Dentists. They have a weekly video series, Mornings with Blatchford, numerous podcasts, and a very active website. Bill and his wife, Carolyn, have been married for 51 years and travel with doctors through Blatchford Adventures. They are blessed with 2 daughters and 3 grandchildren. Preface. In 1970, when my dad graduated from Loyola Dental School in Chicago, he set out for the small college town of Corvallis, Oregon, to begin his career. He came armed with nothing except determination. No dentist in Corvallis was retiring, and the message was clear. We don't need another dentist in our town. Undeterred, Dad hung his shingle at a small rented office near Oregon State. Soon thereafter, a dental school classmate who believed in him decided to join him in Corvallis. Now there were 2. Over the course of several years, Dad grew his practice to $1 million, which was a lot of crowns in 1980. Dentists in the area started hearing how well he was doing, and so he invited them to watch him practice. They noticed they were doing everything Dad was doing except for one thing. His hands never left his patients' mouths the entire day. In other words, the burr was always turning. Dad discovered that he really enjoyed coaching dentists on how to improve their business, focusing on practice management. That epiphany nearly 40 years ago led to the formation of Blatchford Solutions. Over the years, Dad discovered, tinkered, and refined new and better ways to improve efficiency to help create a better life-work balance. Today, Blatchford Solutions boasts a client list of extremely successful doctors. Among them, we formed a group called the Big Docs, or more formally, Ingens Doctorum Sodalitas, whose members individually earn $1.6 million annually or $133,000 monthly. At our recent Big Docs gathering, we focused on what this group is doing differently. What makes the difference? By closely examining their practices and lifestyles, we came up with 7 principles that take a dental practice from good to outstanding. Christina Blatchford, DMD. The Blatchford Mission. Blatchford Solutions is committed to private practice success. We love helping those eager entrepreneurs who want more out of life than just work. We help find a life-work balance by introducing systems that support efficiency, producing equal or better profitability in fewer workdays. We hope this book will offer dentists a path that is more fulfilling, more profitable, and ultimately, more fun. Introduction. Before we jump into the 7 principles, we want to establish a framework for how these pages are to be digested so the experience can be as effective for you as possible. Some doctors will read this book and see hope, possibilities, and a chance to make a difference. Others will think of reasons why these concepts won't work for them. The funny thing is, both are right. Whether you think you can or think you can't, you're right, said Henry Ford. What does that mean? It's all about how we think. To move forward in one's career, to make the difference between where we are now and where we want to be, we have to let go of the excuses we keep reciting to ourselves. I practice in a small town. I don't want to work that hard. I need the right team. I don't know where the economy is going. I practice in a very competitive area. I'm stuck where I am. Ultimately, these excuses become an excuse unto themselves. In other words, because we create reasons why things won't work, we don't even have to try. Now, we're not ignoring that sometimes things outside our control can derail us. Instead, we're focusing on what we can control and how that can make a difference. Here's an example. You had a terrific day, booked to goal. Everything was going well. You took a post-op bite wing of number 31 and discovered an open margin. Did you let that setback ruin your day? Or did you inform the patient that the procedure needs to be redone to meet your high standard of care and found a time to redo? If you sweat the small stuff, if you allow negativity to dictate your thoughts, well, this book was written for you. Because its sole intent is to reframe those thoughts, turn excuses into motivation, and help you find a healthy and lucrative work-life balance. How does an extra $300,000 net and 6 to 8 weeks of vacation sound? The Blatchford method has worked in over 3,000 dental offices across North America. We know it will work for you too, yet it requires the right frame of mind. Thinking about your thinking. Dr. Stephanie Aldridge, a case study. We want to introduce you to a dentist who came to our program last year. Dr. Stephanie Aldridge is taking a much-anticipated 10-year anniversary trip to Munich for Oktoberfest. She can do so with confidence because her practice is thriving with $1 million in revenue, strong internal systems, and a dedicated and accountable team. But it wasn't always the case. Stephanie graduated from Case Western in 1999 and found initial success as an associate, whose owner, doctor, had 2 practices and sold one to her. She worked hard, adding teams and services. By 2008, she had built a solid practice with enough bread-and-butter services to survive, but not necessarily grow. She focused on personal things like getting married, paying off debt, buying a new home, and starting a family. 9 years later, at age 44, Stephanie had an epiphany. The practice was stagnant. She was sick and tired of being sick and tired. She thought, is this all there is? Realizing she needed to quit auto cruise and leave a legacy for her son, she searched for help. She saw a video of Dr. Amanda C. sharing how Blatchford Solutions had helped her work 3 days a week, be a better mom, earn more, and take multiple weeks of vacations. Stephanie did her due diligence, and after researching hundreds of 5-star Google reviews and numerous real testimonials, she signed with Blatchford. She wanted to work a 3-day week, take 6 weeks of vacation, collect $1 million up from $800,000, start an Amazon business. Stephanie's coach, Dr. Christina Blatchford, introduced her to many systems and techniques that started helping from day one. Stephanie was immediately attracted to the Blatchford block booking process, which helps you determine your ideal daily work output and then build a schedule around it. Dr. Blatchford recommended eliminating statements, collecting instead at time of service. Morning huddles and weekly role-playing meetings created an immediate uptick in morale and productivity. Stephanie is proud of her team. When we're in the office, we work together to do whatever it takes to get the job done. The dynamic of the practice has changed, and there's high spirits and energy definitely reflected in our Google reviews. She feels the team is now working with a purpose, living the vision, and giving patients the utmost in professional dental care. Plus, the bonuses and time away doesn't hurt. Dr. Blatchford also coaches Stephanie in leadership and life skills, helping her find empowerment through leading an all-female team and pointing out that it's not necessary to be on call 24/7. After all, a dentist needs a life too. As a result, Stephanie is better rested, more enthusiastic, and living her life the way she chooses. Though Stephanie is only halfway through the Blatchford program, she's grateful for the improvements thus far. The first week we worked only 3 days, the team and I were amazed and grateful. We hold gratitude every morning in our huddle and once a week in our team meeting. My gratitude is that I woke up out of my mommy coma and found the Blatchfords. Principle 1. Create a clear vision for your life. At Blatchford Solutions, step 1 is determining one's vision, a set of personal guidelines and criteria that help doctors reach their goals. Vision is unique to the individual. It's soul-searching and requires effort. Personal vision gives you the direction to which you aspire. Vision is the future, purposefully not addressing the barriers of today. Many dentists see dentistry itself as their vision. This is wrong. Vision is how you want to live your future life, not the nuts and bolts of today's daily struggle. Vision is what you aspire to be. It does not even mention teeth, dentistry, or work. Here's a great example of an inspiring vision. I want, without reservation, to bring glory to God, to honor others, to honor myself, to achieve my destination and enjoy the journey. I want to be a man of wisdom, a man of substantial love, a man of integrity, a man of joy. How inspirational! Of course, since vision is very personal and individual, it would never work to copy someone else's. Your vision must come from searching your own soul. At this point, you might be saying, yeah, but how do I find my vision? Here are some tips. Explore your desires. What is in your heart and the longings in your soul? Look back on your life and review those times when you felt fulfilled. Who are your heroes? Identify the men and women you admire. What stands out about them? Ponder your values, attitudes, and beliefs, insights into what motivates you. Examine your goals, ideals, skills, and interests for ideas on what makes you, you. Ask 5 friends what they think your purpose is in life. For inspiration, listen to your intuition, inner voices, and spiritual sources. Ask, why am I here? A truly inspiring vision is that of a colleague, Dr. Stephen Hatcher, who was kind enough to share it with us. He uses his vision as the backbone and standard for care in his office. Life is about relationships and experiences. I want my life filled with meaningful relationships and unforgettable experiences. First and foremost, I am a father, husband, son, brother, and dentist, in that order of importance. Life is short, and I want the limited time that we have on this earth to be filled with enriching experiences that push our boundaries. I want to experience as much of this life as possible. Before spending eternity with my Heavenly Father, I want to enrich the lives of the people I touch. Honesty, empathy, integrity, and generosity will guide my decisions within my relationships. I will continue to take good care of my body with regular exercise and sound dietary decisions. Providing comprehensive life-changing dentistry will have dramatic impacts on the patients I treat. I hope this has a ripple effect throughout the universe. Being the best comprehensive dentist in the state will provide an abundant income not only for my family, but my team members as well. Beyond helping yourself, your vision can also help others. By knowing who you are and where you're going, you can inspire your family as well as your dental team. A strong vision helps you make decisions. When you know your personal self, your decisions become automatic. Ask yourself, will this new car help me reach my goals and live my vision? Or is it just a shiny new plaything? Am I doing this because it's the right thing to do and matches my vision? Or am I following others and taking the easier path? One day Alice came to a fork in the road and saw a Cheshire cat in a tree. "What road do I take?" she asked. His response was a question, "Where do you want to go?" "I don't know," Alice answered. Then said the cat, "It doesn't matter." A basic human need is certainty. We're all looking for something we can count on. A person with a clear understanding of self lends confidence to others. We are drawn to those with a quiet confidence. Vision and believing in God's promises is demonstrated in the Bible. Proverbs 29:18 says, "Where there is no vision, people will perish." Helen Keller once said, "Life is either a daring adventure or nothing at all." Vision gives you confidence. Without it, as Miss Keller suggests, the daring adventure never happens. Life calls for bold action. Take it and run. We love this quote by Marianne Williamson in her book, A Return to Love, Reflections on the Principles of A Course in Miracles. Our deepest fear is that we are inadequate. Our deepest fear is that we are powerful beyond measure. It is our light, not our darkness, that most frightens us. We ask ourselves, who am I to be brilliant, gorgeous, talented, and fabulous? Actually, who are you not to be? You are a child of God. Your playing small doesn't serve the world. There is nothing enlightened about shrinking so that other people won't feel insecure around you. We are born to make manifest the glory of God that is within us. It's not just in some of us, it's in everyone. And as we let that light shine, we unconsciously give other people permission to do the same. As we are liberated from our own fear, our presence automatically liberates others. The power of vision is immense and far-reaching. Now is your opportunity to write your own personal vision for the future. Apply your passion. Put it to work for you. Make decisions based on your vision. Go forth and change the world. Principle 2. Set a goal. Once your vision becomes a living document, it starts to infuse all areas of your life. You start to become that person. Doors you never noticed before will start to appear, and your vision will encourage you to open them and evaluate if those opportunities are consistent with your life's plan. It's a thrilling place to be, but to get there you need a set of guiding lights to steer the way. Goals are those guiding lights. Like a bullseye to aim at, goals give you a destination, purpose, and motivation. This quote from Goethe speaks directly to the power of setting a goal and acting upon it. Until one is committed, there is hesitancy. Concerning all acts of creation, there is one elementary truth. The moment one definitely commits oneself, providence moves too. A whole stream of events issues from the decision, raising in one's favor all manner of material assistance. Whatever you can do or dream, begin it. Boldness and genius, power and magic in it. Begin it now. In the case of dentistry, goal setting is critical to choosing it as a career. Many dentists say they were attracted to science and were good with their hands. Their childhood goal was to go into medicine. Upon closer examination, they found medicine required long and unscheduled hours away from family, hobbies, and free time. The goal then became dentistry. Getting into dental school was next, and then graduating, which for many of us was a major effort. Of course, the ultimate goal was to start a practice. So what's the goal after that? For many dentists, it's to retire as soon as possible. For others, it's the accumulation of wealth. But that's a nebulous goal and hard to fulfill. Rather, set specific goals within the field of dentistry, which will lead you to the accumulation of wealth and free time. For instance, set a goal to become more proficient and accomplished in a particular treatment, one for which you find a passion. Limiting the number of days you work is another worthy goal, as the time away from the office will not only please you, but your family as well, as they will be happy to spend that time with you and know that they're important in your life. Setting goals, milestones, and landmarks is a critical component of your life's plan. How can you implement the passion you have demonstrated in your vision? The Irish playwright George Bernard Shaw wrote, "This is the true joy in life, being used for a purpose recognized by yourself as a mighty one, being a force of nature instead of a feverish cloud of ailments and grievances complaining that the world will not devote itself to making you happy. I am of the opinion that my life belongs to the whole community as long as I live. It is my privilege to do for it what I can. I want to be thoroughly used up when I die, for the harder I work, the more I live. I rejoice in life for its own sake. Life is no brief candle to me. It is a sort of splendid torch which I have got hold of for the moment, and I want to make it burn as brightly as possible before handing it to future generations. We are inspired by those who have gone before us. Let's make our vision happen. You are what you do, not what you say you will do. The most effective way to do it is to do it. Albert Einstein once said, "If you want to live a happy life, tie it to a goal, not to people or objects." Blatchford's basic rules for goals. Be specific. Define what you really want to achieve. Be definitive. I will rather than I wish or I want. Be measurable. How do you know if you've achieved it? Be accountable. Share goal with a friend. There's no such thing as a successful secret goal. Timeline. By when will this be accomplished? Celebrate your success in reaching that goal. The difference between dreams and reality is called action. I belong to a coaching group called Strategic Coach, which my dad introduced me to. One concept discussed was the motto for Lay's potato chips. No one can eat just one. You start with your first bite and think, it's so delicious and light. I'll have another. And another. All it took was one chip. And just like Lay's, achieving your dream requires that first step, that first effort needed to create movement toward your goal. Once you start, forward momentum makes it that much easier to continue. When working toward big and long-term goals, forward movement is sometimes hard to see, and it is not yet complete, which can be discouraging. We call that living in the gap. The gap makes you feel inadequate because you haven't achieved the big goal, even though you've been working hard to do so. In London, the Underground train posts a sign saying, "Mind the gap," referring to the opening between the platform and the train. When you set a large goal, there will be gaps. Therefore, we like to set mileposts, which serve to break the journey toward the larger goal into smaller, more achievable segments. Dividing large goals into segments and timelines helps set realistic expectations and allows you to feel satisfaction upon achieving them. One goal our new Blatchford doctors often set is, "I will be a big doc next year." This is a very specific goal, as a solo doctor needs to collect $133,000 a month or $1.6 million annually to join the group. If your vision involves being a person of honor or taking better care of yourself, your goals might read, "I will be completely debt-free by January 1st, 2021. I will weigh 180 pounds by July 4th, 2021. Dr. Courtney Levine, a case study. Being specific in her business goals and celebrating those victories with her team has created a whole new outlook for Dr. Courtney Levine. Courtney started her practice from scratch and after 2.5 years realized she was working every day, round the clock, and not making a profit. She was very busy but not very productive. Several dental friends recommended she seek Blatchford for help. She wanted to be more efficient, be more profitable, put organizational systems in place, and spend more time with her husband. Bill and Christina Blatchford's analysis pointed out that she was working too many days and inefficiently at that. They explained she needed to reduce those work days and increase daily production. This was a scary proposition, as Courtney wasn't paying herself a salary, so decreasing days with patients meant less income. But with Blatchford's help, she set specific goals of how many days she wanted to work and how much she wanted to earn. And now, after successfully completing a Blatchford coaching program, she is now much more profitable, and her patient days are predictable, efficient, and more productive. Her team knows what and when to schedule, with no guessing or hoping. Everyone works smarter, not harder, and enjoys tremendous success. Courtney loves celebrating the victories with her team because clear, tangible office goals are the most fun to accomplish. We celebrate together. At first, Courtney's husband was skeptical of paying a large fee to a consultant, but now he's Blatchford's biggest proponent. Though not a dentist and not involved with their practice, he nevertheless sees the value in the Blatchford methodology. Anytime Courtney hits a new challenge, he immediately says, "Call Christina." Plus, he benefits directly from when she hits a goal, as she is happier, more relaxed, with better self-esteem. It's not just her husband. Courtney's entire team sees the positive effects of setting and achieving goals. Office goals are written out and posted in the office, constantly visible to the team. In addition to our BAM bonus and goals for daily and monthly collections, we set goals for things like Google reviews with rewards, she explains. I feel the morning and afternoon huddles are imperative for reviewing the successes and areas needing improvement. It's hard to stay on top of the afternoon huddles, but things unravel when you rush out the door without touching base. Being a young startup, Courtney had doubts about joining Blatchford, thinking her situation was unique and that possibly the program might not work, even though colleagues in the industry encouraged her, saying Blatchford was transformational for them. Her biggest surprise was how quickly the program took hold and made a difference for her team. It does take time outside your normal schedule to organize the systems and implement them, says Courtney, but the payoff is real. Courtney's new goals are: become the premier dental office in Massachusetts for conservative cosmetic dentistry. Focus on cosmetic and complex restorative work with less emphasis on general dentistry. Pay off mortgage on Dream Lake House in 10 years rather than 30. Team to double BAM. Dr. Glenn Spinelli. I feel energized when a goal is met and want to set another one, says Dr. Glenn Spinelli. I was absolutely amazed that all this actually worked. I thought it was too good to be true. Glenn, a doctor specializing in cosmetic dentistry, was so pleased with reaching his goals in his practice, it rubbed off on his personal life. 8 family members enjoyed a Tuscan villa in Italy for 10 memorable days. He upgraded his wife's wedding ring and surprised her by renewing their vows by the same priest who married them 25 years ago. He bought his dream motorcycles and took his son to the Super Bowl, where his team won. Professionally, Glenn completed the GARG implant course and placed his first implant. He completed a grafting and extraction course. He broke free of all insurance contracts. He changed his schedule to 3 patient contact days a week and 9 weeks away. He increased his net income and paid down existing debt by $100,000 in 2 years. His goal-setting example inspired his family to do the same. Observing his success, they began setting their own goals and quickly realized they had more control over their lives than they had previously thought. With goal setting, they saw that you could design your life and not wait for life to design it for you. Glenn's daughter left an unhappy job, and his son changed his major to one that he was passionate about. 2 things surprised Glenn about goal setting in his office. 1, he felt gratitude for his patients. I so appreciate patients who stayed with me after moving to another town or leaving insurance contracts. His gratitude is sincere, and patients sense this. 2, when he asked patients about their own long-term goals, many responded with plans to pursue dentistry, thanks to his example. Glenn's big new goals are making implants a bigger part of his practice, qualify for Blatchford Big Docs at $1.6 million, with 140 patient contact days. South America for 2 weeks in winter. Pay off remaining debt of $50,000. Crazy goal. Own an apartment building for passive income to leave his children. Dr. Rhys Spore. Another goal-setting success involves Dr. Rhys Spore, a veteran dentist specializing in restorative dentistry. He shares this story. With respect to goals, mine have not been complex, but rather quite simple. Be honest, do my best, and do the right thing for my patients. These are the 3 goals I have always strived to achieve. They became a framework by which I've always practiced, and they let me know that the care I give any patient is the same I give to my own family. I found one of the most profound things I did to successfully run a practice for 35 years was to participate in continuing education. You don't know what you don't know, and consequently, you don't know what you might be missing. I've invested thousands of hours and hundreds of thousands of dollars toward that endeavor. Most of it was very valuable, some not as much, but all of it made me a better and more compassionate dentist. Most of the things I do now on a daily basis didn't exist the day I graduated from dental school. It has made my career interesting, challenging, and has allowed me to keep the passion alive to care for people, which was the main reason I went into dentistry. It's so satisfying to be at the peak of your skill and know that you have done your best intellectually to support that high level. It's great to have the mindset and curiosity of a student, which allows you to accept new things rather than just be focused on the past. Several years ago, my longtime friend John Levica, owner of Dental Ceramics Dental Laboratory, and I decided to start a hands-on training course in aesthetics. We called it Aesthetic Excellence. John built an 8-operatory clinic in the laboratory that offers a very comfortable patient experience, combining the utility of a full laboratory with immediate availability. He also created an 80-seat lecture facility adjacent to the clinic, with food service capabilities so the participating doctors and teams can stay immersed in the learning experience. We both had a strong desire to give back to the profession that has rewarded us so well. The uniqueness of this course is a hands-on learning by doing process, not learning by watching or learning by listening. We purposely created a structure that allows a licensed dentist to bring a patient into the state of Ohio, where the lab is located, and treat that patient under our mentoring. The class is 5 days over 2 sessions, approximately 1 month apart. It's more than just a technique, it's a philosophy. And in the past, we found our students' passion was ignited for a higher level of care. From a teaching standpoint, one of the metrics of success is the predictability and the artistry of the outcome. When you have a new dentist a few months out of dental school and another dentist with 40 years of experience under his belt, you have to create a process to keep it interesting for both. We also have dentists with a variety of backgrounds and training that we can successfully incorporate into our structured process. What we consistently observe at the end of a class is that you can't tell which dentist did a particular case. Most of the attendees tell us they not only had fun, but the whole class was transformative. They share a sense of pride that comes from doing high-quality work, especially if they haven't experienced that positive emotional feedback with any of their previous patients. Both John and I get a huge sense of satisfaction about being able to guide or reignite our colleagues' careers. Thanks, Rhys, for so many gifts. Dr. Amanda C. Dr. Amanda C., a Blatchford doctor who focuses on cosmetic and restorative dentistry, sets her goals clearly. I am most proud that I made my time with my family a priority and work comes after that. It didn't happen overnight, but it was the reason I sought Blatchford Coaching several years ago. I felt like time was slipping away and kids were growing before my eyes. She adds, "The professional goal I am most proud of is becoming a COIS clinical instructor. You cannot apply for this position. Rather, it's based on other mentors and participants' evaluations that you demonstrate the skill and understanding of COIS principles and philosophy to the fullest, and have the heart to help others." Being asked to present at the 20th anniversary of the COIS Symposium was such an honor, and one that I will never forget. Amanda admits that being a leader every day at work is a struggle. Everyone experiences dips and valleys, but she knows the importance of leading her team. A practice's culture and attitude stem from the top, so when challenges make her want to sit back and ignore the problems, she knows she can't. Conversely, when a goal is achieved, she feels empowered. Fulfillment is knowing I overcame failures and difficulties to reach a goal. The journey of getting there makes it sobering and real. Goal setting has rubbed off on the C family of 4. My kids tell me things they want to do or be, such as score 10 goals this soccer season, get multiplication tables done in under a minute, keep their room clean and organized. I ask them how they think they can get there and come up with a plan. There is something they can do every single day that will get them closer to that goal. In setting practice goals at the office, Amanda started reducing workdays and increasing daily production. I honestly could not believe it was happening. I thought it may be just a good week or month, but it was consistent and a new reality. I was elated, to say the least. As a leader, Amanda shifts the responsibility of determining bonus increases to the team. I tell them to think about how much they want to make. They all know what their salary is, and that will not change. The only variable is their bonus, and if they work backwards, they can figure out how much our team needs to produce in order for them to achieve that. I was so surprised to find my team and me working less and making more. With this change, I discovered I enjoyed doing dentistry again. Amanda has some big goals, including fellowship with the AACD, American Academy of Cosmetic Dentistry, membership into AAED, and her own teaching center in 5 years. Fellowship with the AACD, the highest level of achievement recognized by the AACD, is a lofty goal. Only upon successful completion of the accreditation process, written exam, clinical cases, oral exam, can you apply for your fellowship. The purpose of AACD fellowship is to provide the highest level of achievement for members in accordance with the AACD's mission of education and excellence. Additionally, to provide a means for the Accreditation Fellowship Committee to evaluate the continuation of clinical excellence and commitment to cosmetic dentistry by its accredited members. It is an invitation-only academy and only for educators in our industry. These are the people who write the textbooks, invent products, and move our profession. Amanda's second goal, gaining membership into AAED, involves these qualification requirements. To be considered as an applicant for associate membership, interested parties must first attend at least 3 AAED annual scientific meetings. They also must be nominated with written endorsement from at least 3 eligible Academy Fellow or Life Fellow members, one of whom must act as the applicant's primary sponsor. Applications of prospective associate members will be reviewed in accordance with such policies and procedures approved by the Executive Council, taking into consideration the candidate's achievements in the areas of academic service, publications, editorial service, honors and/or awards, scientific presentations, and other service to the dental profession. Other considerations may include board certification and/or eligibility and dental specialty. Amanda's most personal goal fills her with excitement. My own teaching center in the next 5 years. I would have it equipped to hold 30 participants for hands-on learning, handpieces, motors, curing lights, etc. at each seat. In addition to my own photography studio that I already have, I would have track studio lights installed in the operatories, a brand new office from the ground up with a learning facility and all the bells and whistles. Plus, traveling to cool cities to do big cases on patients who want my services. Dubai, Monaco, London? Dr. Ben Wong. Dr. Ben Wong feels honored to be included in this book, and if his story can inspire even one soul, he would be ecstatic. Here's his story. The goals I am particularly proud of achieving are usually the ones that scare and humble me when I set out to achieve them. Some of the goals, or milestones as I prefer to call them, are my marathon races and becoming a better clinician in areas of implant surgery, cosmetics, CAD/CAM dentistry, as well as full mouth dentistry. Every goal and milestone that I set has been hard and challenging. The struggle is real for every goal I set on a daily basis. I find that the most difficult obstacle to reaching any goal is usually my own psychology or limiting belief. What helps me through these challenges mentally is to remember why I set out to accomplish them in the first place. Take my marathon training, for example. I had not been running for 10 years. I was out of shape, unable to run half a mile without stopping, when I decided I would complete and finish a marathon. My reason was very simple. I wanted to be a good role model for my 3 kids. I wanted to be more vibrant and healthier than my parents were at the same age. Running long distances is hard, both physically and mentally. The discipline required to maintain a training regimen on a daily basis and the mental fortitude to push through doubts and pain are all part of the challenge. The more challenging the goal, the bigger the emotional reward when it's met. When I set out to complete a marathon, I expected it to be hard, but I had not expected to be overwhelmed by a mixture of positive and almost euphoric emotions when I crossed the finish line. I was overcome by a sense of pride, relief, happiness, gratitude, and a boost in my self-esteem, knowing that I could conquer any obstacles thrown my way. I just have to put in the work. One of the values I want to instill in my kids is the value of hard work, but not just blindly working hard. You have to know what you want and why you want it, then work like hell to make it happen. The whole process of setting goals and putting in the work every day to make it a reality has left some lasting impressions on my family. My wife and I are helping the kids, setting up milestones and goals in different areas of their young lives, such as academic work, piano, and taekwondo practices. We encourage and occasionally threaten them to work hard, and we celebrate when they reach their milestones. When I started reducing days and increasing production in my practice, I was in disbelief and amazement. The whole time and effort versus results concept was foreign and somewhat counterintuitive when it was first introduced. Over time, I've seen my annual production doubled while cutting down on more than 60 working days. I encourage my team to set big, unreasonable goals, at the same time to understand why these goals are important to them. We then discuss our goals and create vision boards to help keep each other accountable. The biggest surprise to me is that I did not find myself to be overly excited when I reached the goals I had set for myself. Whether the goal was to produce X dollars or to cross the marathon line, the satisfaction really comes from the journey and all the hard work I put in along the way. What I realized is reaching a goal does not mean the end. Quite the opposite. It means that it's time to set another goal, because happiness comes from making gradual progress towards it. I've become a much better leader and clinician as a result of setting big practice goals. I've become healthier and fitter as a result of setting a goal to run a marathon. Both of these goals seemed completely unreasonable and unreachable at the time I set them, but I've made both a reality. Nothing grand will happen overnight. It's only through consistent hard work and dedication that dreams are realized. Big goals? I want to be AACD accredited within 3 years, cut another 30 days of practice while increasing my profitability by 50%. I want to complete 2 or 3 marathons a year. Principle 3. Becoming a super dentist. The dentist you become and the things you achieve in your career are set in motion by your vision. Some specialize, while others become what we call super dentists. But at the very least, practicing dentistry requires staying current. Dentistry is changing fast, just as the world around us is accelerating at an unbelievable rate. Keeping up requires hard work. Yet we meet many dentists who are still doing dental school dentistry. That is, they haven't pursued continuing education besides revisiting their former dental school professors. The dental school mandate requires all students to pass their state board. Anything beyond that is up to you. By participating in CE, a general dentist today can become skilled in challenging and fun stuff. And with dental equipment pushing us into the digital world, it's crazy not to keep up. Plus, patients expect you to be their expert. We encourage all our dentists, no matter their age, to complete a comprehensive restorative curriculum like CRE with Dr. John Coyce in Seattle. Your vision may include honoring my profession or demonstrating gratitude or serving others. You might ask, how can I maximize my offerings to live my vision? The answer is simple. Dentistry offers so many specialties, so many facets to enjoy. You can learn new skills and become a one-stop shop for your patients. There are true experts teaching dentures, implants, IV sedation, and so much more. It's your choice as to which direction you want to explore and which specialty you want to be known for. Super dentist is the term Blatchford uses to describe those who truly dive into continuing education post-dental school and embrace the ability to offer patients more knowledge and advice in complex cases. We say, take advantage of your advantage, as we are very fortunate to do what we do as dentists. It is a terrific, challenging business with huge rewards. After all, we give the gift of confidence to people through their smiles. But we can only do so by staying on top of advancements in our field. When taking continuing education, we acquire new skills which result in greater proficiency, greater profitability, and greater satisfaction. Plus, it's easy to take CE. In fact, it's downright enjoyable, as you get to spend time with like-minded dentists who, like you, are continuing their education. However, the tricky part is when you get home. How are you going to implement what you learned into your practice? How will you maintain that forward momentum? My mom was the 4-H queen in her youth, and one of their credos was, make the best even better. That should be your credo too. We have the freedom to choose good, better, or best. But when you add the patient into the equation, we really have only one choice. Every patient should receive the best treatment possible. What would you do for your own mother? One of our favorite super dentists, Dr. Ed Dooley, offers these thoughts. Dentistry is a field that was far more complex and exciting than I had first imagined. I never looked back from that decision to become a dentist. It is a profession full of doors leading to a wonderfully rewarding, challenging, and full life. Passionate about excellence, superdentist Dr. John Highsmith is accomplished in implants, physiologic dentistry, comprehensive restorations, and cosmetics. He has actively sought high-level CE, 200-plus hours a year for as long as he can remember. That alone should recognize him as achieving mastery in his field. But this confirms it. He is AACD accredited, an LVI Fellow, ICOI Diplomat, a Mish Implant Institute Fellow, a Teeth Tomorrow provider, and owner of Lightsmith Photography. As a niche dentist, John excels in several areas, with each concentration demanding high levels of skill, time, and dedication. He is the only AACD accredited dentist for 100 miles in any direction, and has an AACD accredited lab technician across the street. As an LVI clinical instructor for 7 years, John mentored dentists in clinical concepts and techniques and deepened relationships with fellow instructors. Dedicated and curious in dental school, he delved deeply into occlusion and fixed prosthodontics. His early and significant mentor, Dr. Daryl Neighbors, sold John his practice. Other meaningful mentors include Drs. Omer Reed, Pete Dawson, Bill Strupp, Doug Klepper, John's first implant teacher, Carl Mish, Frank Spear, Bill Dickerson, Clayton Chan, Mac Lee, and Bill Dahm. Increasing his focus on areas he enjoyed, John gave up endo, dabbled in ortho enough to realize there were people better skilled, and quit doing perio procedures, except for hygiene scaling and root planing. One of his greatest challenges was learning when to say no. We've come to the understanding that sometimes a prospective patient doesn't need what we do, comments John. We can cherry-pick our patients. I think we're going to start specializing more in nice people. It's so much more fun to select a patient because we like them. John's daily doctor goal is $15,000 a day. The team works 174 days per year. We work 3.5 days and take 3.5 days away to rejuvenate for the next 3.5 workdays. Another accomplished dentist who chooses to remain anonymous, a COIS mentor, defines a superdentist as one who constantly strives to grow and improve the practice of dentistry. A superdentist has considerable training beyond dental school, which allows him or her to provide additional treatment not offered in the first 4 years. Examples would be IV sedation, surgical extractions, implant placement and restoration, and complex restorative treatment. A superdentist also is wise enough to refer to specialists when needed. A superdentist is a great listener. During dental school, when our anonymous superdentist did an externship at a public health clinic, he saw that dentistry offered many more opportunities than general dentistry. He felt that after graduation, a private practice would limit him in the type of treatments he could provide. In his senior year, he asked an attending dentist for advice on the best place to expand his dental education. The dentist recommended an AEGD residency in the U.S. Air Force. In his 3-year Air Force career, our superdentist learned comprehensive diagnosis, treatment planning, and treating complex restorative cases, not only how but why, IV sedation, complex extractions, implant placements and restorations, perio and endosurgery, and straightforward ortho cases. He believed the Air Force residency helped him gain speed and confidence, thanks to the assistance and guidance of attending specialists. He was now ready to buy a private practice, yet he felt some pieces were still missing. At a local study club, Dr. John Coyce performed a 1-day treatment planning session. It was an aha moment for our superdentist, and he immediately started the Coyce curriculum. He then took on the challenge of the mentor exam and presented and defended a case to become a Coyce mentor. Our anonymous superdentist believes the Coyce training has made his dentistry more predictable, not to mention more joyful. As a Coyce mentor, he works with and trains top dentists in his field and has greatly increased his understanding of all things dental. Coyce mentoring keeps him on the cutting edge and excited about dentistry, while offering him a new perspective, focusing on the root of dental disease, not the symptom. When you understand the cause of dental disease, you can address the source, instead of just repairing the damage. He has always set goals, been curious, and striven for excellence. His personal vision involves seeking mentors to help motivate himself and his practice forward. One such mentor was Bill Blatchford, who has offered his expertise in dental business coaching. Another super dentist is Dr. Dan Delrose, a partner in a superb Florida practice where his passion revolves around implants. Dan's goal in dental school was to become the professional with whom other professionals confer. Dan worked and borrowed his way through dental school as a dental lab tech since age 15, and felt postgraduate training would be a financial challenge. The head of the prosthetics department offered him an 18-month fellowship, and to generate room and board, he was the personal dental lab to undergraduate and graduate students. Then came the U.S. Navy, where Dan's goal was training in maxillofacial prosthetics. He knew prosthetics would help severe dental cases, and being in the Navy, realized a fixed option was the way to restore lives and help people reach their goals. Dan's first child was not healthy, so thanks to the Navy, was treated at Johns Hopkins. Dan and his wife needed additional family support, so he left the Navy and joined the practice of Dr. Richard Steinberg in Ellenton, Florida. After 5 years in private practice, performing countless extractions, Dan felt it was time to try something new: implants. This was 15 years ago, when he started out with a week-long course to place single implants. For Dan, it was love at first sight. He continued by training with Nobel's system using digital applications. By then, he was hooked. He took classes with Drs. Ed Mills, Frank Lamar, online videos with Dental XP, lectures by Nelson Pinto, Mike Picos, Ziv Mazur, Robert Miller, Scott Gans, and more. These lecturers showed him other applications he could apply for. Dan became a fellow with ICOI, next a diplomat, and then a diplomat in ABOI. He currently is training in a Dominican Republic dental school, practicing new maxillary sinus surgeries not yet embraced in the United States. His daily doctor goal is $13,000. He takes 10 weeks off, which includes his many CE units. In the last Florida biennium, Dan submitted 158 units. Dan admires his partner, loves his team, and finds his greatest challenge being CEO. Thanks to his Blatchford coaches, who have showed him how to lead his people, take more CE courses, make more money, and have more time for his family, he now owns a practice with a happy team and is on solid financial footing. As a young officer in the Navy, Dan's training was similar to what Dr. Ed Deming taught. Then, after the Navy, he started following Tony Robbins and his method of self-empowerment. So Bill Blatchford was just the next step in a natural progression to reach a higher level of dental expertise. Dan's team is now comprised of businesswomen who run the practice, with Dan as the clinician who helps them reach their goals. He's presently taking 10 to 12 weeks of rest time, 1 week a month, and hopes to continue doing so for a long time. Another super dentist, who also has chosen to remain anonymous, realized during his GPR, when he was learning so many new things about dentistry, that it was just the tip of the iceberg and that he had a lot more to learn. He has since dedicated his professional life to continued learning. He became an associate with a 5-dentist group practicing in Houston's Texas Medical Center, the largest medical center in the world. An older dentist in the practice, who was a master with his hands, taught our anonymous superdentist invaluable lessons about dentistry and how to interact with patients. Early on, he took courses in endo, restorative, cosmetic, implant, and perio. He took a LANAP course, embraced it, and was asked to become a LANAP instructor, traveling the country, giving lectures, and helping new LANAP practitioners. He performed a live LANAP surgery at the Florida State Dental Meeting, which was a wonderful experience, but tough. Along with another dentist in the group, who became his partner for 23 years, he learned implants, and together always sought to improve. Eventually, our super dentist bought out his other partners, and today is the sole owner. He feels it is important to concentrate and master a few disciplines, rather than be a jack of all trades. His goal right now is to learn a new protocol to treat sleep apnea. He found the business side of dentistry to be one area in which he was lacking, but as mentioned earlier, he is always seeking improvement, so that is on his list. Dr. Adam Langen practices in a small town where he and his wife grew up. After paying off all their debt, Adam built a new facility for his dental practice and his wife's optometry practice. As a super dentist, Adam can provide nearly any treatment in the office and do it well, hence the new office. Continuing education is really important to Adam. When he became a Blatchford doctor, he realized there was so much more that he could offer his patients, but didn't have the expertise to do so. Having a coach was the difference maker. Blatchford Coaching encouraged him to start his CE journey with Dr. John Coyce and CRE in Seattle. Courses 1 and 2 opened his eyes to a world of dentistry he thought only formally trained specialists were capable of doing. When Adam completes Coyce in 2019, he will then have a fully rounded knowledge base, one that was learned from the best in the world. After the first 2 Coyce courses, Adam performed implants, digital technology, ortho, endo, perio, dentures, and IV sedation certification. He purchased a CEREC in 2013, completed the full Pacific Implant Institute in Vancouver, BC, followed by more implant seminars. He purchased a cone beam and training, Wave 1 endo, Jarity ortho, and TurbiFill dentures. He completed Drs. Reed and Malamed for IV sedation training. His digital learning came online, joining CE websites on cone beam, 3D printing, surgical guide fabrication, and more. He is grateful for the strong mentoring he received from his mom and dad, as well as his wife and Bill Blatchford. He values the new friendships and connections he forges with doctors who share his search for self-improvement, each working together and pushing the other forward. Being asked about a case from someone he admires really gives him confidence in his own skills and trainings. Adam enjoys full mouth restoration, whether by denture fabrication, full mouth CB, or full mouth implant placement. He likes the digital treatment planning, design, and fabrication. His most challenging treatments right now are Class 2 non-extraction ortho and molar endo. He dislikes removing premolars to treat bite discrepancies, so he learned how to treat nearly any case without extractions, though it adds a difficulty factor. He recognizes his CE choices have given him tremendous skills and knowledge. As a hands-on dentist, Adam takes an active part in all areas of patient treatments, from executing treatment planning to digital case design and fabrication of wax-ups, models, and restorations. He loves technology and the direction digital dentistry is heading and wants to remain on the cutting edge. Dr. Justin Griffin, a superdentist in Columbia, South Carolina, shared these thoughts. I had 9 months before dental school started. I was hired as a dental assistant and worked in a cosmetic dental office. During that time, I fell in love with smiles. I decided I wanted to be so much more than a dentist. I saw what a repaired and natural smile did for patients. I wanted to improve self-esteem, self-confidence, and literally change lives through cosmetic dentistry. And this has been my pursuit, to change lives through changing smiles. Superdentist Dr. Donnie Kildew, who practices in Arizona, shares her story. In school, I loved math and science. When graduation time came, my father informed me girls don't go to college, and if he was going to pay for college, it would be for my brothers, not me. So I went to a 2-year technical school for an associate's degree in dental assisting. I got a job at MCV Dental School in their DAU program. We were trained as EDDAs and taught junior students how to utilize an assistant with four-handed technique. Since I was an employee at MCV, I could attend VCU tuition-free nights and weekends. I obtained my prereqs to apply to dental school. I never received a bachelor's degree, but was accepted into every dental school I applied to. I started Georgetown Dental School with a 2-year-old and an 8-month-old baby. I'm told I qualify as a superdentist. I never thought of myself as that. I just pursued answers when I didn't know how to help my patients. But as I think back on my career, I know I was not satisfied with just practicing the basic skills. I used to say that I learned enough in dental school to not hurt anyone, but that is exactly what happens when you don't have the skill set and knowledge to help patients with their teeth. I remember thinking when I graduated from dental school that there wasn't anything I didn't know. I soon discovered that wasn't the case. It became obvious when my first patient with worn, thin teeth came in, or the one with the painful pop in her jaw. I had heard about the Pankey Institute, so I attended all the continuums, and then I became a CE addict. I set my sights on the ultimate goal of obtaining my MAGD. I had the privilege of hearing Dr. Frank Spore speak. He and Dr. John Coyce created CRE, Creating Restorative Excellence, in Fife, Washington. I completed all their continuums. I joined AACD and became the general member representative on their board. My goal was to obtain voting rights for the general members. At that time, only accredited members could vote for board members. I wasn't successful at the time, but they now have voting rights. I met some wonderful people with AACD. Dr. Rena Vacay, Dr. Jim Elias, Dr. Lynn Jones. They were such great role models. From there, I attended the UCLA Aesthetic Continuum with Dr. Brian Lesage, Dr. Jeff Morley, Dr. Ed McLaren, and Dr. Jimmy Eubanks. I then traveled to learn more with Dr. Jimmy Eubanks at his office in the middle of somewhere in Texas. Dr. Bill Blatchford suggested that I add sleep apnea to my practice. So I worked with Dr. Stephen Greenman and got that going. Through an AGD podcast, I learned about the connection between periodontal disease and overall health and well-being. Since we have started our non-surgical periodontal program working with oral DNA, we have not had to refer a single patient to a periodontist, and our patients' health has improved. My passion has always been to stay challenged so dentistry doesn't get boring. I could never list all the courses I have taken in my career. It would take too many pages. I hired an associate to do the things I don't enjoy, like anything that involves blood. My most favorite procedure to do is full mouth rehab. No one hugs you and cries when you do a great filling, but change the way they look, it just makes me tingle. What's challenging for me now is getting my sleep apnea practice going. It's been very slow, and getting physicians to work with us has been extremely frustrating. My other big challenge is that I'm always thinking about how to improve my practice. Luckily, I have an amazing team who get excited about my ideas. I no longer see patients on Fridays and only come in for our 4x4s. I also take off 9 weeks a year and now have more time for my family and myself. I have 3 older children, 5 grandchildren, and an 11-year-old son. I take home cases to wax up from time to time, as I do enjoy it. But I have started using John Levicka of Dental Ceramics, who I met at the Big Docs meeting. I practice in a snowbird retirement community, over 55 in age to live here. Summers are slow and winters are crazy. My daily doctor goal is $10,062. To keep morale up at the office, my attitude is most important, but we also treat ourselves to spa days, dinners together with our spouses, and Starbucks runs. We compliment each other in front of one another, and my team likes their bonuses, which have been running about $1,000 each BAM cycle since the last dynamo. This team is on fire. I could not do any of this without the support of my husband. He is an author and works from home on marketing his book, The Legacy Letters. He takes care of our son and all the details, which allows me not to worry about home life. He is also in charge of marketing my practice and planning our wonderful travel vacations. Since joining Blatchford, we have visited Norway, Scotland, Amsterdam, Cuba, Austria, and Germany, where I picked up my gorgeous BMW. Thanks, Brad. We actually just got back from 2 weeks in Spain and Gibraltar. Principle 4. Put proven systems in place. It's critically important to put proven systems in place in order to support your vision. Without strong systems, which maintain the level of service, efficiency, and clinical skills of the team, your practice can enter a frustrating and potentially crippling free fall. Systems are put in place to support your vision, so no one on your team needs to press the hold button to ask a repetitive or redundant question. Without structure, a new person joining your team can alter the way your office functions. They bring the way we did it in Dr. Bauman's practice. Systems are important for so many reasons. When training a new team member, systems must be in place and written down so they can be easily followed. The military employs rigid systems and can replace a whole crew on an aircraft carrier, and the work continues meticulously. Why? Because the systems are known, written down, and practiced. Navy pilots flying jets on a stormy night don't worry when half the crew is new. They know the systems are strong and all is well. Another reason for employing strong systems is image. We want to project an extremely polished image to patients. Without systems, a practice can appear haphazard, chaotic, and unprofessional. For example, forgetting the superoxyl when seating a case. This actually happened in my own office recently. We didn't follow our own system, which was documented. It's easy to wing it, thinking we do this every single day and I know what to do. The problem with that is we're all human and can make a mistake every now and then. It's critical to have a system in place for everything you do in the office. An easy way to implement office systems is to visit Marcia Freeman's website, www.marciafreeman.com. Every conceivable situation has been documented in a system in Word document form, so it's easy to use as a template and tailor to your own office's particular needs. Another crucial system to have in place is the way appointments are scheduled. In my practice, we have a solid system called block booking, which sets goals, parameters for treatments, focus, and achievement. We use telephone scripts for how the phone is answered. Is it, "Good afternoon, doctor's office," or "Thank you for choosing Dr. Osgood," where life-changing smiles are created? "How can I help you?" Put in a tagline that inspires people and makes them understand they called the right office. Employment policies are a system. When hiring, I look for "yes, we can" team members, those who are yes people. "Yes, we can do that, and I'll find a way to make that happen" people. Systems in place create profitability and can mitigate issues when things go awry. For example, prior to having systems in place, a receptionist was injured in a snowstorm. It was unclear whether she could or wanted to return. It appeared as though she might possibly be milking the system, as the job was being held for her return. She ended up quitting. All the knowledge left with her, and the dental practice was held in limbo for several months. Strong systems in place could have prevented that. Hygiene, scheduling, and collecting can be shared responsibilities throughout a treatment room. It requires some cross-training, but really is impressive to the patient. Talk about a one-stop shop. Efficiency is a system. Periodically ask yourself, are we doing things as efficiently as possible with the technology that's available today? Are procedures performed in a timely manner? Are you a diddler, or do you and your team remain conscious of time spent in the office? Make checklists and then follow them. For instance, make sure all your instruments are on your tray. Don't you hate it when you're working on a patient and an instrument is missing? Having an assistant rise from the chair to get the instrument looks unprofessional, appearing to the patient that you don't know what you're doing. Checklists are the answer. Consistency is a system. It's one of the hallmarks of the Blatchford system. When our coaches come to your office, we operate consistently with proven methods that work. By doing things the same way, we know you will get predictable results every time. Being consistent allows us to focus on more important things, like improving each system by 10%. Ask yourself what you need to do to improve each of your office systems by 10%. Cottonwood Dental is a mother-daughter team in Highlands Ranch, Colorado, just 25 minutes south of Denver. This is truly a family practice, as Dr. Jim DeLapp, who was the original owner, encouraged his wife, Candace, to try dentistry as a career. Candace was an administrative assistant in the neurology department at University of Colorado for 17 years. Through night school and working full-time, Candace became a dentist and worked alongside her husband for 18 years. When Candace and Jim worked together, they decided one dental income was plenty, so they each worked part-time with separate and distinct teams. There was a healthy competition between the two groups. The dental life inspired their only child, Sarah, to become a dentist, now Candace's partner. Sarah realized from a young age what a wonderful thing her parents did to change someone's life with the gift of a smile. When Sarah joined the practice, Jim decided to pursue his passion for teaching, moving on to instructing dental students at UCO in Aurora. Together, mother and daughter have created a strong vision of how they want to live their lives, their standards for patient care, and the impact they have on patients. Because of their strong vision, they have empowered their team, giving them permission to make decisions based upon the doctor's vision and permission for the team to help patients say yes. With a work week of 3.5 days, the team loves the time off. They become more efficient when they're aware of overhead per hour and what each appointment is worth, says Candace. When combined with block booking, it's a beautiful thing. They schedule efficiently for large cases and do simple restorations and hygiene. Everyone truly embraces teamwork, and it makes the office work like a dream. And of course, they love the bonus, remarks Sarah. The last 2 cycles have exceeded $2,000 in bonus for each team member. Cross-training is always a work in progress, making sure the patient receives the best customer care possible. Mother and daughter admit there was some turnover when new ideas were presented and implemented. The chain is only as strong as its weakest link, and letting the weak link go allowed the team to grow, comments Candace. Candace and Sarah share an assistant, a system that works for them. So the assistant is always available when needed. With more and more technology being used, they found this to be a successful system. Their next goal is to implement CBCT imaging, as well as all-on-4 restorations. They have a daily office goal of $7,100 among 3 team members. Sarah and Candace acknowledge a great support system that makes all this possible. The DeLapp Village consists of an extended family of hands-on dad, grandpa, and 3 grandchildren. Jim can be proud of his legacy. As Candace puts it, Dr. Jim is always amazed and excited when we tell him what we collected for the day and the new procedures we have introduced. Dr. Jason Ganong. Dr. Jason Ganong shares the most important system in his office is block booking. His practice includes implant, Invisalign, and cosmetic dentistry, but general dentistry is really the biggest portion of the practice. He has a daily goal of $13,000 and has averaged that this year so far. The office is currently seeing patients 13 days a month, but they are looking forward to going to 12-day cycles next year with bigger goals in mind. They worked 14 days a month last year and are exceeding those numbers thanks to their systems. Cross-training has been another important system in his practice. He has 6 amazing team members that are all well-trained. He has found talented, positive, and supportive team members who encourage and help one another on a daily basis. Everyone can take radiographs, sterilize instruments, answer phones, take payments, etc. This allows team members to step in for one another when they are needed, providing efficient care and productive use of patient and doctor's time. Dr. Ganong has a broad scope of practice thanks in part to his 6 years as an active-duty Army dentist. He spent 2 years of service in an AEGD program, learning a broad and diverse skill set. In addition, he has spent well over 1,000 hours in continuing education. His background includes almost all of the Spore curriculum, MISH, Galler Rain Gauge, as well as various other courses. Although the education costs seem very expensive at the time, they have repaid in dividends, allowing him to see and do more dentistry. They have been the second best investment into his practice. My most important investment has been Blatchford Consulting. Given my background as a clinical dentist with no business background in the Army, I did not want to spend 10 to 15 years figuring out what doesn't work as a business owner. This September marks 8 years in private practice, all working with Blatchford. My consultants not only encouraged me to dive into advanced education, they taught me patients want the dentistry we offer because we help them see the value. Principle 5. Become an expert in communication skills and marketing. It was less than 20 years ago when dentistry formally recognized the process of getting a patient to say yes. No longer hidden by case presentation, it was out in the open, formally and unabashedly called sales. Being good at sales is a skill, and the more you study, the more you learn it's simply a conversation. A guided conversation, yes, but a conversation nonetheless, as if with a friend. We still hear from staff, "Oh, I don't sell. I want nothing to do with putting pressure on my patients. That's just wrong and I won't do it." They're partially right. The old method of sales was to move people into a corner and apply pressure until they purchased or left upset. As Brian Tracy says, pressure sales are Neanderthal sales. But nowadays, sales needn't be pressured. Teams and doctors are slowly moving from needs-based to wants-based questions. The paradigm has shifted to, no one needs what we have to offer. If they don't need it, then our conversations must turn to what they want. How can you put pressure on someone when you're talking with them about their favorite subject, themselves, and asking what they think about their teeth and smile? Conversations should only be about the patient. We recommend the 80-20 rule here. Your guest gets to talk 80% of the time, with the remaining 20% left for you to ask questions. If you flip this equation, you may be violating the no-pressure rule. With no-pressure sales, it's okay for patients to say, "No, I don't think so now." They'll be back because you've maintained a warm, honest, pleasant relationship with them. It sounds easy, and it is. The important point to remember is sales is a lifelong learning process. Blatchford doctors read, and apply. They write scripts, they role play, and practice. When you think you know it, but really don't, you wing it instead, and the conversation ends up being just a conversation, not one that moves to the result you desire. At Blatchford Solutions, we spend half the time on sales, half the time on leadership, and the other half on systems. In other words, a 150% effort is needed. Are you up for it? Our most successful doctors and teams actually role play for the first 5 minutes of their morning huddle. This is easy to do. You have real-life patients coming in that day, so you don't need to reach far to find a role-playing scenario. Some examples: a recall patient whose treatment has been completed, or a first-time patient. Success with sales conversations comes with your willingness to be uncomfortable. We get it. At first, a sales conversation with a patient will make you and your team uncomfortable. This is because you're not used to doing it. Practice and then practice some more, and things will get easier and more comfortable. We have to work at this to make it feel natural. I once was employed at Nordstrom for a year in sales. When I first started, I noticed some of the other department members were better at it than I was. I called my father and said, "Dad, this isn't fair. I went to college, and the salespeople who are doing the best didn't." He, of course, pointed out that life is not fair, which I had heard before. He then had me start in the Blatchford Solutions sales program. I read 7 different books on selling that year. One thing he told me that really resonated: when you see someone who is successfully doing something that you want to do, copy their behavior. What is this person doing that I'm not? 7 books I currently recommend. 1. Integrity Selling for the 21st Century, Ron Willingham. 2. Little Red Book of Sales, Jeffrey Gitomer. 3. How to Win Friends and Influence People, Dale Carnegie. 4. How to Master the Art of Selling, Tom Hopkins. 5. Brilliant Selling, What the Best Salespeople Know, Do, and Say, Tom Bird and Jeremy Castle. Number 6, The Psychology of Selling, Brian Tracy. Number 7, To Sell is Human, Daniel H. Pink. I started observing my successful coworkers to see what they were doing that maybe I wasn't. What I found was they were spending the time to listen to their customers to find out what they wanted. They were discovering what the customer did for a living, what events he or she was looking forward to, what family members were up to. Then they were able to find specific conversation pieces that would work for specific sales situations. It was my aha moment. Burning leads is the dreaded outcome in which businesses have marketed, but the sales force is either untrained, unmotivated, or the internal systems are not in place to handle the new client. The net effect is a real loss, as the new client is turned off by the marketing and responds with a no. Dentistry is new to marketing. Our product is based on emotion and desire. We all want to look our best, with a bright, gorgeous smile. But dentists are uncertain how to tap into that world of desire. And there are no certainties in marketing, no guarantees that one approach will be the magic bullet. We all hope that what we do will bring in new patients. Yet, in many cases, we haven't evaluated our internal structure and sales skills to make certain we can market to new clients with care and consideration. In many practices, there's a disconnect between the marketing department and the sales department. We're told every new call should be handled the same way it's always been done. We're learning that a client responding to your message from a print ad, radio, direct mail, or website is different from an internally generated referral who has endorsed you. Marketed clients have no relationship with you and are still in the looking stage. They're evaluating how you connect on the phone, as well as listening and watching during your initial conversations in person. What is a marketed client looking for? There are many levels of inquiry, yet basically they want to know the following. Can I trust you? Do you care about me as a person, or am I just a tooth? Do you see me as an important individual, or is it about you? Make certain you communicate with your team about your marketing materials, messaging, and voice of your brand. This is the who, what, when, where, and why. Who are you appealing to? What results are you seeking? What vibe do you want to impart? Write possible scripts for phone inquiries, emphasizing emotion and empathy. Change from order-taking mentality, just the facts, ma'am, to asking questions that make them feel heard and make it easy for them to enter your care. Your potential clients are viewing websites 24/7. We're finding that people are calling with specific treatment questions like, I want 8 veneers and a lower bridge with no gold showing. When specific dental treatment is requested, it's appropriate to ask, where are you in your research? Some marketed patients have fully researched their treatment options and are interviewing potential dentists to find one they trust to do the work. At this point, you're on their short list. Make the grade by asking, what qualities are you looking for in a dentist? How can we make sure we satisfy your needs? This will open up the floodgates of emotion, personal history, and other important information. In addition to mastering no-pressure sales skills, examine your internal structure for how you and your team appeal to marketed clients. Greet them by name. Find out their favorite beverage and provide it, along with other personal amenities, each time they visit. Be on time and avoid long forums while they sit waiting. Build trust by asking questions. Get them to open up and share their thoughts and feelings. Listen and respond with more questions. Do not talk about yourself. Let your office do the talking, reflecting your brand with nicely framed after pictures, elegant but simple decor, discussions held in quiet places, complete bathroom amenities, and an upscale yet small reception area. Practice as a team before launching your marketing. Be ready to meet their needs. Another form of marketing that you should consider is called search engine marketing, SEM. It's a form of internet marketing that involves the promotion of websites by increasing their visibility in search engine results pages, primarily through paid advertising. SEM may incorporate search engine optimization, SEO, which adjusts or rewrites website content and site architecture to achieve a higher ranking in search engine results pages. SEM is technical, the opposite of being empathetic with potential patients, but it's absolutely a necessity in today's competitive dental marketplace. Dr. Dana Shoemate is willing to share his enthusiasm and results in working with sales and marketing. As a team, they have regular meetings where they role-play with sales conversations. It was so awkward at first, but practice makes perfect. One person's individual ability helps with team solidarity. In our team meetings, we discuss recent guests with whom conversations were terrific and the ones we could have improved. Changing your behavioral style to be more compatible with your guest's personality is the key to making them feel more comfortable. We read books as a team. I assign a few chapters and the results really surprised me. I had expected the team to be half involved and complaining about reading. I couldn't have been more wrong. We have awesome discussions and sometimes they get something completely different out of the text than I do. I love to see their take on what they read, and many times their ideas are much better than mine. I feel like getting the team to spearhead the conversation is integral for the doctor. Once my team started asking probing questions and had good conversations with our guests, I didn't feel the pressure of doing everything myself. I feel the team likes the autonomy to ask these important conversations. My team will say something like, "Many times when Dr. Shoemate sees something like this, he would recommend a crown." I encourage my team to be active in the process. This helps our guests to be thinking before I enter the room. It also reinforces trust. I know that everything my team and I have discussed with our guest will be reinforced in the consult room. Everyone can close a case. Our guests' experience are a collective effort, from the initial phone call to the swiping of the card and final pictures. We always discuss success stories in our meetings, and we review how everyone had a part to play in that success. We noticed that the less pressure we put on our guests, the better. We just let them tell us what they want, and that's when the team started to bonus. They really started working on the power questions. We are a work in progress, but they can see that asking great questions serves everyone better. I love going in to anesthetize, for one thing, and my assistant tells me we are doing more. Our guests love getting more treatments completed in less time. As far as marketing goes, we started with 0 patients. Our marketing helped me create a consistent brand with multiple contacts. The more contacts a patient has before even setting foot in the door, the better. Initially, we only did direct mail, which helped us build a solid patient base. We then made sure our internal marketing was the best it could be. Lately, we do fewer mailings and more website management. The majority of our top 20% of patients come from existing patient referrals, as over half of our new patients come from the internet. We keep a spreadsheet on our marketing efforts. We need to be able to quantitatively evaluate our marketing. We evaluate at least quarterly and make any necessary changes. We have been fee-for-service since we started. Because we aren't insurance members, we need to do more external marketing. Paying for a new patient once is better than paying for them every time you see them. We do file insurance, and currently we are 55% insured and 45% uninsured. I believe in the slight edge concept. The many small things you do better than everyone else adds up to a large result in the end. Yes, we do participate with baseball sponsorship, fun runs, health fairs, charitable fundraisers, and community theater. I want to thank Blatchford Solutions for helping me see my potential and giving me more time with my family. With 3 kids going in all different directions, it is so important to have a family downtime. Doctors Mike and Aaron Kelly share, We read a book a month as a team, sometimes a TED Talk or a podcast. Integrity selling in the 21st century really helped the team to recognize and treat each of the 4 distinct personalities. The team realized we can't treat every person the same and need to tailor our conversations and presentations to each person's wants and needs. With Simon Sinek's TED Talk, Start With Why, we discussed the why of our office. As a team, we boiled it down to 2 simple words: help people. On the phone or in the dental chair, how can I make this guest's situation the best? If we treat people well, the reputation, gratification, and money will follow. Our team continually works on rehearsing situations. We started by rehearsing the everyday conversations we have on the phone and in the chair. We progressed to the more unusual conversations as they come up. During each session, we review the basics and conversations we have daily. Very quickly after our initial Blatchford seminar, our team understood how they can make an impact and really took it upon themselves to make the changes envisioned. By the time we arrive at the treatment room, 95% of the case is discussed and reviewed before I even see the patient. Team members do not diagnose, but team members understand what I would say to the patient in a certain situation. Our presentations really seem to take off when the team members say the same phrases we would say. Then, when I enter the room and literally say the same thing, treatment is accepted much more readily. This way, the dentist gets to be the cheerleader. Because the majority of treatment has been discussed before I enter the room, the dentist can say how excited I am for them and how much better X will make the smile, chewing, etc. We review the procedures and protocols so the dentists are extremely confident the team is on the same page. If we see something needing improvement in a presentation, we review in a team meeting. As the breadth of treatments offered in our office grows, we review everything with the team to know and support how it works. For instance, we are in the process of offering PRF and PRP when the need arises. We go over the process and to why, how, and when to use the procedure. We also review the cost with the entire team. We set up who will do the phlebotomy. All team members offered to learn if they didn't already know. Everyone can close a case. Sometimes a case can actually be closed on the initial phone conversation. We are all looking to find the patient's chief wants and desires and how to make it happen. All team members have heard me say, make it happen. A case is closed when the patient is scheduled and ideally has paid for treatment in advance, possibly with care credit. We figured out how much our daily production should be. We took 80% of that number and saved that for morning blocks. We worked together to discover what treatments would make this happen. We block for implants, crowns, and mini-implant denture cases. The team knows not to put something else in those blocks unless they don't want to make a bonus. For marketing, we started from scratch in 2005. We had really researched the area for demographics, disposable income, and schools for the eventual family. Although most of our decisions were based on gut instinct, the practice steadily grew in size and reputation. We did reach a point where we absolutely outgrew our business sense, needing structure and systems to give patients the continued level of care they deserve. Blatchford Solutions absolutely helped forward the dream and make it an ever-evolving reality. Initially, we started our marketing with cheaper advertising with the most results. Our community is small, so our local paper works. We graduated to TV commercials, which work well as the public sees us as real people whom they may have met before. We do wish we had hired a business consultant right away, so the growing pains of having our own practice would have been much less. The return on investment more than makes up for the initial cost of Blatchford Coaching. Our marketing company has been amazing for our office. They created our website to feature the treatments we promote like cosmetic makeovers and implant dentistry. They have also helped us with Google reviews. Our new patient numbers increased by 35%. Currently, we are seeing about 50 new patients a month with 2 dentists. Periodically, we review our marketing to see our ROI and make changes. We look at internal and external marketing ratios, as the goal is to increase referrals from existing patients. We have a self-insure program for 2 cleanings, an emergency exam, necessary x-rays, and 10% off treatment with some exclusions. It is a win-win for patients and the office. We started it when dental insurance companies became worse and many patients dropped their policies. We are fee-for-service and don't look for volume. We are not trying to treat every patient, just the people who appreciate and want quality work with quality materials and great customer service. Dr. Randy Mitchmore, DDS, MAGD, a super dentist who practices in Houston, Texas, finds true delight in helping people find their happiness. While incorporating advanced techniques and the latest technologies to make patients as comfortable as possible, he also understands that there is more to dentistry than simply a restored smile. He is dedicated to getting to know each of his patients on a personal level, learning more about what makes them happy, and giving back to the community. Randy is making his mark in dentistry and is willing to share how he and his highly trained and motivated team present dental possibilities as a well-choreographed dance. Let's hear it for the $3 million results. I am the one and only dentist in the practice. There are 3 dental chairs. With the help of 6 highly motivated team members, the practice produces more than $3 million annually. We are bursting the thinking that to produce more, you need a bigger office and more treatment rooms. The team brings maturity, compassion, and a willingness to learn. For that, they are paid at the top of the scale and rewarded with lucrative bonuses. We shy away from terms like front and back to foster a team atmosphere. Each team member's job title reflects more what they do individually to make the patient's experience over the top. A Make It Happen officer, Chief Enthusiasm Officer, Director of Details, etc. My office door is always open. Team members bring me solutions, not problems. Conscious of the different personalities, Randy says, I have studied sales for many years and have learned how to flex my personality type to be outgoing and match or mirror the personality type of the person with whom I'm working. My team is also blessed with diversity of gender, ethnicity, age, and sexual orientation. We even have a special needs employee who brings joy. This diversity matches the broad cross-section of patients we serve and is very important in sales. Team members are encouraged to identify their own personality type and that of others. From there, they have the building blocks of how to communicate with patients, other team members, even family and friends. Differences in how the personality types approach the world are evident. Using the strengths of each creates a team and is genius. Sales is truly a daily conversation. During our morning meeting, we identify patients who deserve a conversation about what's next. To me, suture removal means we have completed one step. It is imperative we see appointments like deliver crowns, deliver retainer, post-op, denture, etc. These are all opportunities that are screaming the message, what do I do next? These appointments are all sales opportunities. This means slow down. Have a conversation about what they originally said they wanted. Congratulate and celebrate the treatment just completed. The theme of my practice is the gift of a life smile. We talk about how they received a small piece of that gift, and there are others just like them who would like this same thing, but don't know it is possible or where to get it. We share with them how much they can help so many other people just like them by writing a testimonial, making a video testimonial to share, or writing a Google review to help others. I always like to present a little gift to a patient who has completed a large case or completed something small, but to them was a major commitment. The cost of the gift can be very, very small. It is how the gift is presented with our humble gratitude and thanks as we celebrate this event together that makes it meaningful. I love to have the patient take a picture with me on their own phone so that they can post it on Facebook. The hygiene schedule is given the same scrutiny by reviewing the patients and being aware of unscheduled pending treatment that has been presented. If the hygiene schedule is booked tightly, we identify who can help with the conversation about the next treatment phase and get it scheduled. I have another hygienist with a primary function of treatment, coordinator, new patient interviews, and follow-up. If the hygiene patient has a relatively modest need of a few $1,000s in treatment, it can frequently be scheduled as part of the hygiene appointment. However, larger cases need more discussion and arrangements that cannot take place in the 1-hour hygiene visit. In steps, the treatment coordinator or planning appointment is made. Sales is not a one-time event. Many things have to happen right with the patient before the ultimate score is taken. Do they say yes or do they say no to moving forward with dental treatment? Perhaps a not now. I have identified over 15 steps with my team and the role each person has in that process. Some of the bigger steps include the overall mission or belief about why my practice exists. What are my core values and beliefs? Because that is what will determine what types of patients will be attracted to my office. This is especially important because for over 30 years, I have not taken insurance assignments. Patients come to see me because they are attracted to me, versus looking for someone taking their insurance. One more reason I have to get it right. That belief system or culture is what is going to give flavor to my website and any marketing. Then, the physical appearance of the office must be in alignment both inside and out, including the parking area. The outgoing welcome video, email, shock and awe package, and handwritten personal note must be heartfelt. The initial phone call must be handled exceedingly well with someone trained in sales, because I know I will not get a second chance. It's a waste of marketing dollars if less than 90% of people calling to make an appointment somehow fail to get in because the initial phone call was not handled well. Instead of pouring more money into marketing, it makes more sense to pour more into training on the importance of the telephone. That person is one of the higher paid positions in my office. Once the day arrives for the first visit, I treat that like a professional play on Broadway. We actually rehearse with a pretend new patient where every team member is going to sit or stand when the new patient opens the front door. Then, who is going to make the initial greeting calling the new patient by name, followed by how the new patient is going to be introduced to the next team member and escorted to the treatment room to begin the interview and records. It continues from there before I come into the room to receive a very detailed handoff about this new guest. After many years in practice, I still haven't had a new patient call to make an appointment for a full mouth restoration and already have a check made out for over $70,000. They typically will call wanting a checkup and my teeth cleaned. They're asking to go on a first date to see if this is a safe place, right for them. We see the appointment as a way to open the door for a much more important and larger conversation. It takes professional sales training to know how to ask what sometimes can be a large number of questions during that clinical interview to finally uncover the gut-burning issues that a patient may have. We treat every new patient as a potential full-mouth restoration patient, no matter what. It doesn't matter what they look like, what they do, or what car they drive. They deserve a 2-hour appointment for the most thorough dental physical they have ever had, using a 35-point checklist and including the AACD standard photos plus special views and a full mouth x-ray exam. Because so much detail is taken in and so much information has been shared, they deserve a complimentary planning appointment another day. Just like I have never purchased a $60,000 automobile after spending only 10 minutes at the dealership, most patients will not commit to a $60,000 treatment plan after a 10-minute new patient exam. In my experience, the larger the case, the larger the amount of time required working with the patient to get to the final agreement. It has been said it's not always the best lawyer that wins a case, it's the best prepared lawyer who wins. I carefully prepare and choreograph the treatment planning appointment. I review the photos and x-rays with my treatment coordinator or whomever is going to be sitting in on the planning appointment in the doctor's study with the patient. We review why the patient came in, what they said they wanted in the patient's exact words, and what is the real motivation. A written agenda for the planning appointment is prepared to review with the patient when they arrive. The patient receives a small thank you gift when they arrive for their planning appointment. We are on time. At this stage in my career, I view my job as a leader to be a teacher for my younger team members so they can learn this process, the why and the how. We are constantly tweaking the presentation and letting new team members begin by working on smaller cases first. My entire team owns sales. Their bonus depends on it. Our numbers are reviewed at the end of every day. This is our sales scorecard. The hygienist reports separately on what dentistry was presented and scheduled. Everyone on the team knows how to look on our computer and where we are in reaching bonus for the current month or cycle. My team totally handles the load. I am the cheerleader and watchdog. We rehearse. How can we make doing 2 or 3 crowns a benefit to the patient instead of doing the 1 crown scheduled today? It is forbidden to put anything in my first appointment of the day unless it is high production. It's easy to fill up an appointment schedule with a lot of small appointments. It can be hard to stick to our stated goals to hold high production time open. Principle 6. Become a financial expert. Know the numbers in your practice and in your life. Overhead is the biggest factor in figuring your net return. It's really very simple. Gross income is income before any expenses are paid. After expenses, which include rent, laboratory, team and their taxes, dental supplies, and more, the remainder is your net, before personal taxes. The problem with overhead, we allow it to be whatever it is, and we take home what's left over, whatever that is. This is backwards because we allow our expenses to run our business. Since you're in business to make a living and a profit, how about starting from that position? Decide what percentage of net you want to support your lifestyle, pay down debt, save for retirement, and fund emergency savings. It is possible to have 55% overhead, which means you take home 45%. It's sad to see a highly skilled dentist, for all her effort, to make only $200,000 when she's producing $1 million and allowing her overhead to be 80%. This also includes debt reduction, taxes, retirement and savings, plus living expenses. No wonder dentists are frustrated. Be tough, be smart, state your net first, and make your overhead work for you, not the other way around, with the tail wagging your profitability. The percentage of overhead is a choice. Too many dentists place too much emphasis on gross production rather than net return. What you bring home is a choice. By being very aware of expenses, having the intention and determination to earn and keep 45%. Currently, dental overhead in the U.S. approaches 80%, which means net return is a low 20%. How is it that some dentists are able to operate at 55% or under? During boom economic times, dentistry is on many a priority list, and being successful is easier. Yet most dentists, even in good times, find the money may come in, yet there's never enough. What continually causes the squeeze? Blatchford doctors are big believers in budgets. To many, the thought of a budget is problematic, as it feels like a diet. Budgets restrict us, denying us of all the fun stuff. But a solid budget allows for necessary purchases, improvements, continuing education, and the fun stuff too. A budget is based on percentages, which allows you to monitor on a monthly and quarterly basis. What is currently happening? What choices do I need to make to keep within budget and take home 45%? Here's a typical dental budget. Rent at 5%, equipment at 5%, marketing at 3 to 10%, lab expenses at or about 10%, assigning an equivalent lab bill for CAD/CAM, dental supplies at 5%, and total team expenses at 20%. Team expenses is one item you can control. It's the largest item in your budget, and most offices are staffed at 30% to 35%. If you're producing $100,000 a month and not watching your numbers, your inattention is costing you an extra $10,000 in net. It's easy to abdicate leadership regarding team overhead when your focus is on the technical aspects of dentistry. A team member says, "I need more help in the front." Without looking at your budget, your numbers, and failing to question the why, you say, "Okay, take care of it." You have just committed yourself to an annual $30,000 plus and allowed your team to dictate your overhead. Your team should be privy to your budget, percentages, targets, and goals. When they know the numbers and know a fair bonus system is part of your practice, your team becomes accountable for those numbers and for making the practice work. Good team members make your practice their own. What does it take to put your team at 20%? Leadership, a roadmap to the future, strong systems like block booking, complete cross-training, coaching to goal at the morning huddle, weekly team meetings about numbers, monthly training sessions, fully computerized systems so hygiene can schedule, produce insurance forms, charge slips, and collect money, increasing collections at TOS, applying the 80-20 rule to your practice so marketing money is effective, being positive, energized, and most important, everyone mastering sales conversations with guests by reading books, role-playing, and encouragement. It also takes a doctor willing to diagnose long-term treatment plans rather than single-tooth dentistry, so blocks are filled. Besides looking at your staff at 20% of collection, other indicators of overstaffing could be more people working in the front than those producing the dentistry, layers of supervisors and managers, staff members with little or no patient contact. When you feel overhead is just something that happens and you're not in charge of net income, it hurts your family, your team, and your patients. When finances have control over you, do you make decisions about patient care in a different way, like choosing a less competent lab, or diagnosing only what you feel patients will accept rather than discussing long-term dreams and treatment plans? Does your financial pinch make you offer less than your best? Choose your 55% overhead by creating budgets and then live within the numbers, especially for team, the one area you can change. Make the bold decisions to take home 45%. It can be and should be yours. Within the artistry of dentistry, attention to details and numbers will affect the end result. The same applies to the business of dentistry. Size matters. Numbers make a difference, and it's not just about being big. The doctor with the largest gross is not the winner if the net return is only 20%. Why would you choose to work so hard for so little? Dentistry is a lot like fishing stories. When speaking with other dentists, we remember the largest number we ever produced and round it off to the nearest 100. Do we ever mention net or numbers that count? I remember as a rookie dentist hearing those boastful conversations and being frustrated because I thought they were true, that gross mattered. No one ever mentioned net. Paying attention to practice numbers ensures a favorable outcome, just as in your technical work. Ignoring numbers is a choice, which can result in those numbers moving in the wrong direction. Slipping, sliding, and guessing are not so good when size matters. $1 million practice should net $400,000. Why would you work hard to produce a large gross and take home less? Which would you rather have, a practice gross of $800,000 and a net of $350,000, or a practice gross of $1 million and a take-home of $200,000? These are choices we make about size. Let's examine more sizes. Not only is there a choice between gross and net, there's also a choice between numbers of new patients and case acceptance. Some dentists cry out for more new patients, yet lack the skills of relationship and the self-awareness of dreams and wants. New patients are wasted in this environment. With the current state of sales training, you can do well with one quality new patient a day. Instead of large new patient numbers, success is found through focused sales skills, where conversations are about want and not about need and pressure to purchase. Relax. Find out who they are and what they want, and how you can help them. Every team member needs to be on board with good personal skills. Now, size matters regarding the doctor, too. If you're a seasoned veteran and requiring over 60 minutes to routinely prepare a lab crown, you've got a case of the slows. Combine that with a staff of 6 and you're working hard, very hard. Take more hands-on classes and create efficiency skills in the treatment room. Work from a laminated checklist and avoid being a diddler. Size matters in scheduling treatment. If you don't know your overhead per hour, how can you cover it each hour? A big overhead and little income is not a pretty thing. Combine an 80% overhead with a team of 6 to 8, all involved in the Crown of the Year Club, and dentistry is not so fun. An average overhead is about $250 to $300 an hour. Do you have a goal of covering your overhead per hour? Consider, too, just reaching your overhead per hour is a tie game, and no one wins a tie game. Size matters in the relationship of your lab bill to collection. It's very difficult to make a good living in the Crown of the Year Club. If you use CAD/CAM technology, assign a lab bill in your calculations. Your lab percentage should be in the 9 to 11% range for a general practice, which means you're diagnosing beyond the magic insurance maximums. Congratulations, you're the right size. Size matters. You want a higher lab bill, a lower team percentage, a bigger net versus gross, and a higher case acceptance from fewer quality patients. Set your goal for the large numbers to be large, the small numbers to be small, and remember, size does matter. Drs. Kay and Matt Giulianelli share their financial expertise in watching the numbers. We like to keep a close eye on our new patient caller conversions rates. We spend a lot of effort and money on marketing each month to make the phone ring. We want to make sure new callers know they have found the right practice and schedule them for their first visit. Our goal is to have 70% conversions across the board. Our conversion rates for the year from different marketing sources are 73% from our main website, 80% from our sedation website, 88% from direct mail, and 95% from patient referrals. We just launched a cosmetic denture website, and we will be checking it frequently. We track the amount of treatment presented and treatment scheduled daily. It's important because we might be approaching the burnout phase if our diagnosis is low. It also lets the team know where we are in closing cases. Treatment diagnosed should be 3 times our daily goal of $10,000, and scheduled should be close to that. Our team really watches the bonus numbers. As we approach the end of a bonus cycle and it looks like they will bonus, it's amazing to see how geared up their energy is to do whatever it takes to make it happen. Same-day dentistry is a must. We used to look at production and collection figures before Blatchford. Now we know it's collection figures which need the emphasis, and more importantly, it's the net return that really counts. What are you taking home? We have found 3-month-old CPA figures to be just history. They compare to industry averages as benchmarks. Who wants to be average? We want to compare ourselves to the top 10% of practices. We use awesome financial advisors and great bookkeepers who provide us with excellent real-time feedback and reports. We feel fortunate to have been introduced to these so early in our practice ownership. Peter Drucker, a famous business consultant, once said, "What gets measured gets managed." If we want to improve in any area, we must keep track of it. If numbers aren't going in the right direction, we must look at ourselves as leaders. Oftentimes, by making small course corrections in our leadership, things tend to work out. If it's something other than leadership, we find the breakdown and fix it. Then we call upon our advisors for help and see where we can make improvements. Things that we never looked at before include number of calls not answered from our tracker phone lines. We currently have 6 different lines. For the first 3 months of this year, we had 105 calls from all the lines, and 26 calls were missed. In our morning huddle, we acknowledged those missed calls and called them back that day. We called all the missed calls, and 25% of those called us back, and we converted 95% of them. When we watch numbers, we grow. We may not be the largest producing practice, but we can increase our net by keeping our collections healthy and our overhead under control. Principle 7. Live within your means. After nearly 40 years of coaching dentists on the business of dentistry, we've observed all forms of end results. Dentists who wanted a net of $750,000 and were able to responsibly adjust to doubling their net. Others who understood the real meaning of deserve level and were uncomfortable making that much money or working less than 40 hours a week. Others who doubled their net and went crazy thinking it would last forever, making unwise purchases and squandering their newly earned income. Blatchford Solutions does not do financial planning. Instead, we help you achieve your business goals. How you choose to spend, save, or pay down debt is up to you and your financial advisor. We want to share a wise man's take on financial success. Dr. Chris Mueller has been a Blatchford doctor for 14 years. Weigh his words well. My understanding of financial management began at a very early age. My grandparents were role models as examples of living within your means. They were Depression-era children of rural Idaho farmers, and they never threw anything away until it was completely worn out. They lived in a modest home in Seattle that my grandfather built himself. He worked as a real estate appraiser and earned a solid middle-class income, but you never would have thought of him as wealthy. He saved and invested his entire life and was able to make large donations to universities, create scholarships, and other causes, enough so that a multi-page feature article in the Seattle Times was written about him. I remember as a youth him telling me, "The second million sure came a lot quicker than the first." This blew my mind to think my grandfather was a millionaire. When he passed away, his vehicle was a high-mileage compact Mazda truck. He was a big believer in paying the Lord first and yourself second, meaning paying 10% to his church and 10% into savings before any other purchases. He also taught all of us to avoid unnecessary debt and to be on the receiving end of interest payments. My mother was a coupon clipper, and I can remember sitting in the shopping cart as she went through her coupon organizer, finding coupons for 5 cents off this or 15 cents off that. We also had a very organized chore chart with corresponding allowances. I had a flower bed that was my responsibility for weeding, and I was paid 50 cents for weeding it, as well as 15 cents for doing the dishes, 25 cents for mowing the front lawn, etc. These were paid out monthly at a Sunday family meeting. Now, when we wanted something, it was our decision as to how to spend our earnings. We had to evaluate at a young age whether something was worth spending our money on it. We got to decide if we really wanted that toy or video game or firework. It also created responsibility. I vividly remember giving up half my savings to pay $1,000 for the dent I put in the family car at age 16. This created a framework of evaluating purchases that would serve us well as adults. My father was also an appraiser and never earned more than what would be considered middle income. He was a hard worker and avoided unnecessary debt, and had our family home paid off when I was 14. Being debt-free allowed our family of 6 many advantages, chief among them the ability to weather financial hardship. When my father's employer closed amidst an industry downturn and older employees were being released in favor of cheaper and younger labor, my father was unemployed for an extended time. Having 2 children in college and myself on a church mission, times were tight. My family was even buying groceries with my paper route savings at one point. Had we had a mortgage at that time, we would have been forced into bankruptcy and lost our home. He weathered the storm and was able to start his own company, which allowed my parents to retire in comfort. My parents were able to help cover housing and food costs during undergraduate college, but we were on our own for tuition and books. I think this is a good approach, as it helps the child avoid burdensome debt, but also continues to allow the child to make decisions on how to spend their hard-earned money. Earning scholarships gave us a tangible reward versus just giving my parents a break. We also selected colleges that were a good deal and majors that were worth the investment. Dental school was up to me. I used up my life savings to cover the first quarter of school. I lived at home and commuted 1.5 hours on the bus each way to the University of Washington to save money. Buying used equipment and sharing, I only needed to borrow an additional $8,000 that first year. After getting married before the following year, we were able to use my wife's salary and frugal living to graduate in 2001 with only $15,000 in debt. I empathize with the recent grads and the high cost of schooling today. There is no way I could have done that with the current state of affairs. I entered the workforce and found working as an associate not to be to my liking. After 8 months, I made the decision to purchase a practice that was very close to closing down due to the owner's health issues. It was a 900-square-foot fixer-upper with old equipment in a strip mall, IKEA furniture, and mid-'80s decor. I offered him $170,000, and he took it. It had produced in the $400,000s, but was down in the $250,000 range that year. It allowed me to start with a patient base and cash flow and work on slowly improving things. 1 year later, the adjacent dentist, who had his own building, passed away unexpectedly, and I was able to purchase the building and practice for $520,000. I now had 2 sets of old equipment and a building with early 70s decor. We're talking yellow, orange, and green here, but I had a larger patient base and corresponding cash flow. It was at this point I met Bill at Dr. Rhys Spore's anterior course, and soon after began my 14-year association with Blatchford Solutions. Practice management programs are not inexpensive. One might suppose, given my admittedly frugal upbringing, being 33 years old, and together with 2 house purchases being $1.3 million in debt, that hiring Blatchford Solutions would not be reasonable. I would argue that to the contrary. Every year, trying to figure it out on my own would have been a far greater cost. I remember at my first Blatchford conference in Vegas, other dentists coming up to me and telling me how lucky I was to get started on this so early. They were right. Systems were set in place for scheduling with daily, monthly, yearly goals, team bonus, appointment flow, marketing, and so on. A daily goal was originally set in 2004 for $5,000 a day. Production went from $430,000 pre-merger to $700,000 the year after the merger, working 180 days. Every year we have gradually increased collections and worked less. In 2017, we hit $2 million on 160 days, overhead averaging between 56 and 58%. My facility did not meet the image we wanted to portray. First, we remodeled the waiting room, followed by the hygiene rooms and sterilization. Then we finished the restorative operatories and consult room. This occurred over the course of a few years and was paid for with cash as we could afford it. I replaced all the chairs with newly upholstered used ADEC chairs and delivery systems, and have continued to try and find quality used equipment, if possible. My most recent purchase was a 3-year-old CBCT scanner for 60% off the purchase price, again with cash. I'm pretty sure my supplier has given up on me for equipment sales. One area I don't skimp on is quality CE. I found out early on the value of hands-on courses, taking 3 different ones from Rhys Spore in his office in Seattle, where I learned a whole system for anterior aesthetics and posterior bonded porcelain that has changed my practice. Classes at the Koi Center have allowed me to offer more comprehensive treatment approaches. Live patient implant classes have allowed me to offer a wide range of implant services. Third molar extractions pushed my surgical skills. Seeing a lecture on a procedure does not compare to having someone over your shoulder giving you the confidence and ability to try something new. We try to stick to my grandfather's advice on investing. We pay 10% first and then pay ourselves next, investing in secure long-term investments such as rental properties, group apartment investments, and stocks and mutual funds. Starting early is the key, due to the magic of compounding interest, which is why we started while still in dental school with a Roth IRA. Having adequate income, we began to pay down debt with the excess after paying ourselves. First was the smallest, my student debt. Then we rolled that payment into the next smallest, and so on. Eventually, we sent in the last debt payment before I turned 40. My wife was a CPA for a Big 5 firm before our twins were born, and since then has managed our books. She tracks the numbers meticulously so we know our expenses. We never carry a balance on a credit card and use them for most purchases to maximize the rewards. While we have a comfortable home with a view of Seattle and the Puget Sound, we were well within our credit line in purchasing it. I don't invest in cars, and although reliable, mine are not flashy. Family time is important to us, so we try to spend our time and money on vacations and experiences. I enjoy boating, so we have invested in a boat that allows all 7 of us to spend time together on the water. We plan our vacations a year ahead of time, and I don't mind spending time or money on these experiences. We have enjoyed traveling my ancestors' homeland of Germany, gone to Switzerland, Disney cruises, Colorado river rafting, boating on Lake Powell, camping in the Virgin Islands, yearly ski vacations to Mount Bachelor, and so on. With my oldest children soon to leave home, these investments are no-brainers. In summary, I attribute my success in business to having started out with Blatchford Solutions 18 months out of school and staying with it. Gradually, all the goals I set at the beginning of the program have been fulfilled. The team around me at work is the best yet and supports my vision. My family life has benefited the most from this success, since quite simply, I can spend more time with them. As I write this, we are coming off only working 5 days in July, which allowed us to strengthen our family bonds and just be together. Others, including my parents, shake their heads at all the time off, but disconnecting from the world and connecting with each other is the best investment, in my opinion. Conclusion. We hope you enjoyed this book and will think about applying these principles to your own lives and practices. We see them as the difference between profitable and highly profitable. Creating a vision for your life and practice. Setting goals. Becoming the best dentist you can be, a super dentist. Putting proven systems in place. Becoming an expert in communication and marketing. Becoming a financial expert. Living within your means. When we think of super dentists, we think of all our clients. One who comes to mind started with us 6 years ago, producing $600,000. He's now approaching $2 million as a single doctor, working 150 days a year. He loves the practice of dentistry, partially because of the big rewards, and partially because he gets to spend time with his young family. He is constantly challenged with new ideas, new equipment, and new patients. At Blatchford Solutions, we love seeing a lifetime of success for our doctors. We feel that dentistry is extremely rewarding and the greatest profession, as it provides patients with the gift of health, function, and aesthetics. Yet so often we find dentists unhappy with their lives and practices, thinking it is different from what they envisioned when they decided to go to dental school. That's where dental coaching comes in. We work with doctors who are right out of school, purchasing their first practice, and doctors who have been in practice for many years. Always from the more seasoned doctors, we hear, "Why didn't I do this earlier?" There is no greater joy in my professional life than to see our doctors reach and exceed their goals through our coaching. The clock is ticking. It's time to live your best life. What are you waiting for?